Hello everyone, and today we're going to be diving into a common and often painful condition that affects many women. It's dysmenorrhea, or painful periods. You may know it as PMS, PMT, PMDD, and we'll cover the differences between primary and secondary dysmenorrhea, their causes, and a mix of conventional and herbal treatments to help manage your symptoms. So what is dysmenorrhea? Well, essentially it's menstrual pain, but it comes from two forms. So you have primary and secondary. Primary is what we usually think of when we talk about painful periods. It starts within the first year of menstruation and peaks during your 20s and 30s, and it typically begins right before or with your period and lasts for about 2 to 3 days, with the worst pain about 24 hours in, and it can be relieved by painkillers, oral contraceptives, and sometimes childbirth. Secondary dysmenorrhea is linked to underlying conditions such as endometriosis, adenomyosis, and fibroids, or even pelvic inflammatory disease, PID. Now, in this case, the pain often gets worse over time, and it can start 1 to 2 weeks before your period and isn't necessarily helped with NSAIDs. So what does dysmenorrhea feel like? Well, primary dysmenorrhea typically causes a dull, achy pain in the lower abdomen that can radiate down to the groin, the thighs, and even cause a dragging sensation in the vagina and a sense of fullness in the bowel. It's not uncommon to feel like everything is about to fall out. Now, secondary dysmenorrhea, depending on the cause, can bring more intense pain and additional symptoms like heavy bleeding, blood clots, and discomfort that worsens as your cycle progresses. Now let's briefly look at the conditions that cause secondary dysmenorrhea. So there's endometriosis. Now that typically will have severe pain that starts 1 to 2 weeks before a bleed and isn't relieved by oral contraceptives. Adenomyosis. This has a knife-like pain that worsens with age and often comes with blood clots. There's pelvic inflammatory disease, PID, and pain that spreads around the abdomen, and typically over-the-counter painkillers don't help. Fibroids. Now, fibroids can be symptomless, but sometimes they cause pressure and frequent urination. And there's ectopic pregnancies. Now, this isn't a medical emergency. It's characterized by a sharp, one-sided pain in the pelvic area and some pelvic tenderness. Like common PMS symptoms, along with the pain, can be accompanied. These can include things as headaches, fatigue, nausea, constipation or diarrhea, mood swings, and urinary frequency. To test and to diagnose and to rule out any of the secondary conditions, doctors will use several tests to get to the root cause of dysmenorrhea. You have the blood tests to check for anemia or inflammation. You have cervical swabs to rule out infections like chlamydia. Ultrasounds are used for checking abnormalities such as fibroids or cysts, and in more complicated cases, a laparoscopy may be needed to diagnose conditions such as endometriosis. So the big question is, why does it hurt so much? The pain is often due to inflammatory pathways and uterine contractions. During menstruation, your body releases a hormone called prostaglandin. Prostaglandins are chemicals that cause your uterus to contract, which in turn leads to cramping and pain. The highest levels of these prostaglandins are released during the first 48 hours of your period, which is why symptoms are usually worse during this time. Now, for some women, another hormone called vasopressin can be elevated, causing more severe cramping and pain. Now, there's several risk factors that can make dysmenorrhea more likely. These include early menarche. So this is whenever you started having your period early or went through puberty very early. If you have a family history of painful periods, if you are obese, if you have a history of smoking, or the dietary factors. So if you're eating a lot of red meat, any dairy, you will increase the amount of inflammation in your body. Now, from doctors, the primary treatment for dysmenorrhea is non-steroidal anti-inflammatory drugs like ibuprofen, which block the production of prostaglandins. Contraceptives can be used to decrease the menstrual fluid and to reduce the amount of prostaglandins in your system. But for about 1% of women, this will not work. And in those cases, calcium antagonists or more advanced hormonal treatments may be considered. So then, if that's from the orthodox, what can we do from a herbal perspective? So let's dive into herbal treatments. Herbalists approach dysmenorrhea by looking at whether or not it's congestive or spastic in nature. So hormone-modulating herbs such as black cohosh, peony, and licorice can really help balance the reproductive system. Anti-inflammatory herbs such as ginger, black cohosh, and willowbark can help reduce the prostaglandin production, making them natural alternatives to non-steroidal anti-inflammatories. And then for this spastic nature, antispasmodic herbs such as ginkgo biloba, valerian, and chamomile can help balance and relax the muscles and ease cramping. Now, these herbs can be taken 2 or 3 days before menstruation begins for maximum relief. However, if you're using hormonal herbs, you might want to be able to take those throughout your cycle. There's some uterine tonics and analgesics that can be really helpful. Herbs such as yarrow, Angelica sinensis or dong quai, and motherwort, which help improve uterine function. They're helpful for pain relief as a natural analgesic. And then really the king of this is willowbark, wild yam, fennel are often really helpful for easing discomfort. Now moving on to diet and lifestyle changes. So a diet rich in nuts, seeds, and leafy greens and whole grains has been shown to reduce inflammation. Anthocyanin-rich foods like berries, cherries, pomegranates are great for reducing pain and inflammation. And supplements like vitamin D, calcium, and magnesium have been proven to reduce symptoms. Exercise can also be really helpful, and something as simple as a hot water bottle or a ginger compress on the abdomen can bring quick relief. So here's an example of a tincture that I would recommend for the days leading up to menstruation to help ease with cramping and pain. The herbs are cramp bark, wild yam, leonoris, Tea racemosa, which is black cohosh, and ginger. So in summary, whilst dysmenorrhea can be painful and frustrating, there's a variety of ways to help manage it, whether it's through non-steroidal anti-inflammatories, herbal remedies, or making lifestyle changes to inhibit the prostaglandins being released. The key is finding the combination that works best for you. Thank you for watching. I hope you find it helpful. Don't forget to like, subscribe, and share with someone who you might think will benefit from this video. And take care, and hopefully I will see you again soon.